Hey there, welcome you all. So how everybody is doing? All are doing great, right? So how was your XMas? So we are having class just on the next day of XMas. I didn't want to, but the thing is, our time is very precious, right? Okay, so just some people are still to join. Till then, just a brief introduction. Senior resident in ENT head neck surgery and your mentor here for ENT and other related stuffs for your NeetPg examination. So basically, I try to cover up the important topics that are important for you for coming NeetPg examination, right? So the goal is again same. We will see how to get these in short time, right? So right, earlier classes are there on the recording, and if you want the link I can message you, so just WhatsApp me or in the Telegram you can post me, right? So all are there, the recorded sessions are there, you need not to worry much. So we can start, right? Yeah. Now coming to tuberculosis, now this is one topic which is there in the medicine. Don't be pushed around by your fears, rather be led by the dreams in your heart, right? So start giving initiatives for the things that you think that you deserve, right? Because until and unless you give your efforts, you push yourself, you are not going to achieve it, right? So nobody else is going to do it for yourself. You have to make it possible for yourself by putting the efforts, right? So be led by the dreams, by the positive things that you have. Now just a quick review of 2-3 questions that we had discussed in the last session, and I hope that now you will be able to answer it. So tuberculous otitis media of middle ear has all of the following except multiple perforations, pale granuloma, ATT, and painful otorrhea. So just a small pause, and I'll just move to another question. Let us see if you remember this or not, because yes, your tuberculosis otitis media is really important. Okay, so all of you are right. Painful otorrhea is not seen. Important is to see what your examiner is asking. So he is asking except multiple perforation, pale granulomas, all are the feature of tubercular otitis media, right? So what you see is a painless, odorless, and otorrhea that will be refractory to the antibiotics, right? Another thing that we will say is multiple tympanic membrane perforations that may combine to form a single large perforation also. Your middle ear mucosa will be pale. Around the eustachian tube you might get congestion, pale granulations in the mastoid, severe deafness with bony necrosis. That means the signs will be more than the symptoms. Patient is having no symptoms as such except painless, odorless otorrhea, but you will observe that he is having moderate to severe conductive hearing loss. Why? Because of necrosis of the ossicles. So here there is ossicular necrosis also, but you will on examination you will just see multiple perforation with painless otorrhea. So usually in chronic otitis media safe variety which presents like this, there is no ossicular erosion. Ossicular erosion is a feature of squamosal variety of COM, right? So unsafe variety of COM or cholesteatoma presents to us with bony necrosis. But tubercular otitis media is something where again you find bony necrosis resulting in severe deafness. One interesting thing is with the discharge you might get facial paralysis and labyrinthitis. So these are also not something which is common with otorrhea, which is painless, odorless. So these these are again features of your squamosal variety or unsafe variety of chronic otitis media, but they might be present with the tubercular otitis media. So that is why it is important for you to diagnose this, right? So many times these patients go undiagnosed or underdiagnosed due to the less symptoms they present with, and ultimately when the things go towards the worser side. Even after trying all the antibiotics, it is not responding. You send the discharge for this Zn staining and culture, and you see that the patient is having tubercular otitis media. So you will start the patient on antitubercular therapy, and you will do mastectomy for removing the focus, the infective focus. So this is otoscopic picture of multiple perforation. Here you can see the pale granulations that are there in the middle ear mucosa. Again, this was something which discussed little fast that day. Surgery to widen the cartilaginous part of external auditory canal. So again, you start the call, and because this was your recent year question, I hope you will be able to answer it. Right. So all of you are right. It is myetoplasty. Right. Myringoplasty is your reconstruction of the tympanic membrane perforation. Right. So this is myringoplasty. Tympanoplasty is along with the reconstruction of the tympanic membrane. You check the middle ear ossicles for dislocation or continuity. Otoplasty is reconstruction of pinna, and tympanoplasty we had discussed. So myetoplasty, what you are doing is you are widening the cartilaginous part. So it's a surgical procedure where what we do is we remove the conchal cartilage. So from behind, from post-auricular region, you remove a segment of conchal cartilage, and then you split the skin of the this pinna, and you suture it by this wide. So main goal is to make the external auditory canal wide. And why we are doing it? After the operations like canal wall down, mastectomy, in post-operative phase, you want to inspect inside the mastoid cavity and the ear. So you have made a common cavity, and you need to inspect and clean whatever is there in the cavity. So you need a wide access, and that is why myetoplasty is. Keep giving the efforts, right? So nothing is impossible for anyone. If you keep on improving, if you keep on reducing the mistakes that you do, you would be able to clear it in your first attempt. This is not something which is very difficult. Only thing is sincere efforts are needed, right? So mostly two things that people lack is, one is proper guidance, and another is the persistent effort. So if you have both the things, you would be able to clear the exams, not only your profs but your main NeetPg exam. And believe me, once you clear this NeetPg exams, your life becomes pretty comfortable, right? It's pretty easy, I would say, because then you start liking the things, you start loving the work you are doing. If you are into surgery, you would start loving the surgery. If you into medicine, you would start loving seeing patients, treating them. So once you start loving the work you are doing, you would be enjoying the process. I can understand the things are a little hazy and difficult right now, because right now you have only one work to sit and study. But as you get through the exam, you would be applying things. Whatever you have learned in your 5.5 years, 6 years, or 7 years, you would be applying it and seeing the results. So I hope and I wish you all a great journey ahead. For now, I would end this with great wishes and happiness to all of you, right? So stay happy and keep giving your efforts. This is Dr. Shivam. Bye bye, take care, and good night.